because they had decided their own health care over not being jabbed with the COVID-19 injection. You would expect all hands on deck. Anastasia Palaszczuk, where in Queensland is the pandemic if you can quarantine healthy young people for 2 weeks, double vaxxed with a negative PCR test in a Gold Coast hospital? You would think we had a bed shortage. Where is it, Anastasia? We are not denying COVID's existence, nor the seriousness of someone dying with it, but it must be proportionate. A case does not mean you are sick. Yep. You may just have a runny nose. Anastasia Palaszczuk, you have threatened our critical medical capacity. Our hospitals before COVID have already been struggling. Do not count on all the new grads picking up the slack, because if you refer to the Nurses Grid network, 17.5% of new nurses leave in the first year and 33% leave in 2 years. Every nurse that I have trained in a practical setting in the community all say that the university training is inadequate and mostly irrelevant.
Yes!
They say that they would not know what to do and they feel lost when put in a hospital setting. And without our talented, experienced nurses to guide them, our hospitals are now in serious trouble. This government has caused medical apartheid in our workplaces, division in families, communities, churches because of the tyrannical vaccine mandate.
Very sorry to interrupt.
Healthcare workers demand that this government dissolve an appalling, irrational, irresponsible vaccine mandate and reinstate all workers. Healthcare is between you and your doctor. It is not between your doctor and the government. Mr. Morrison, you have said that we live in a democracy, and we, as the co-deputy chair of APRA, the governing body of health professionals, put a gagging order on doctors and nurses in March this year. APRA has not allowed any doctor or nurse to speak up regarding the COVID vaccine and the ill effects of it. And if they did, they were threatened with the loss of their registration. So now, we nurses and health professionals are going to speak out. We are sick and tired of being silenced. In our ED departments, CCU, ICU and general wards, the nurses, doctors, paramedics, social workers, radiographers, occupational therapists, and the list just goes on, are seeing multiple adverse, life-threatening effects from this COVID-19 injection. Nurses and healthcare workers are being coerced, bullied, manipulated and threatened by their peers because they have chosen not to receive an experimental medical procedure that has not completed its safety trials and proven to be safe. They have risked everything to make a stand. Nurses and healthcare workers are forced to choose between their health and their career. A career they have given their lives to, spent thousands of dollars on HEX fees, and for what? I call on all vaxxed and un-vaxxed nurses, doctors and allied health to come out from behind the curtain and stand with us against this medical apartheid. Dismissive behaviour. That is not healthcare. It is health sabotage.
Yes!
Our healthcare system has now been compromised. Come out, all healthcare workers, and stand by your code of ethics to do no harm. They cannot sack all of us. This government is creating in our country an atmosphere of division, fear, confusion, anger and deceit. There are many good healthcare workers. But what makes them great is that they had the courage of their convictions.